There are a number of types of scanning that we undertake in pregnancy. The first, and probably the most important one, is the viability scan. And by that we mean checking that the baby is alive or not. This scan can be done as early as 5.5 or 6 weeks, where we see for the first time the fetal heart beating, the flicker of the fetal heart. And that perhaps is the most exciting moment when a fetal heart is confirmed for both parents. When I'm doing the scan and making sure that all is fine and satisfactory, I turn the screen and show it to the parents, and I can see the joy on their face, or both faces, with great excitement. And that actually is great satisfaction. So the early pregnancy viability scan perhaps is the one that excites people most. In the United Kingdom, we scan at about 10-11 weeks with an abdominal scan to assess the duration of pregnancy, the gestational age. And that, of course, has greater value, greater benefit for the obstetric management of the patient when we know exactly how many weeks she is. After the 10-11 week scan, the next stage of ultrasound in obstetrics or during pregnancy is what we call the anomaly scan. It is, in fact, a better term for it is the normal anatomy scan, because at 20 weeks, all baby's organs have formed and have formed very well. So the anatomical landmarks can clearly be visualized. And at that time, we determine that they are entirely normal. The 20-week scan is one of the standard milestones in obstetric care in most European countries and America. Having more scans in pregnancy will depend very much on a number of factors. One is when the baby is not growing well, or when the baby is growing too big and a clinician would like to determine the cause for the poor or slow growth or the excessive growth. And that becomes more of a medical anticipation and medical management of anticipated problems. And that's another area where obstetric scanning has a great role. Now, of course, we're talking about pregnancy in general, and that brings to mind determining if the woman has 1 or 2 or even more babies. And at that point in time, the early pregnancy scan, whether it's at 6 weeks, 10 weeks, or 20 weeks, determining the, as we call it, multiple pregnancy becomes extremely important for a variety of reasons, because twin pregnancies can be coming from 2 eggs, and therefore the babies have a different genetic constituency, or they could come from 1 egg that has split after fertilization and becomes identical twins. And for these identical twins, the risks are higher, and therefore to determine the chorionicity and the twin pregnancy at an early stage becomes very important. Of course, there are other scans, and that is baby bonding scans. Patients, women they're not patients, in fact, women and their partners would like to see the baby throughout pregnancy, and bonding with the baby with an ultrasound scan during pregnancy is phenomenally popular in many cultures. And people want to see their baby, they want to have images, they want to have a 3D or 4D image of the baby throughout the pregnancy. And there is evidence to suggest that babies hear the sound of their mothers, even if they are inside the uterus, and babies react to their mother's voice, as well as sometimes they react to the ultrasound scan during the scanning procedure by moving faster or moving more frequently during the scan. So with these types of scans we can offer at our clinic, of course, we have to practice within our professional guidelines. We have to practice within the regulations and the guidance notes issued by professional bodies such as the Royal College of Obstetricians and Gynaecologists and British Medical Ultrasound Society. So we keep and ensure that we maintain safety to mother and baby. In transvaginal scanning, if it is done in early pregnancy, then the bladder needs to be emptied. However, if we're doing a scan at 10 or 11 weeks, then we need a relatively full bladder. So it lifts the uterus from the pelvis and makes it more accessible and visible to the abdominal ultrasound approach. At 20 weeks gestation, we don't normally require any full bladder. The ultrasound technique is very safe and is very acceptable. And in the past 40 or 50 years, or even more, no adverse effects of ultrasound have been demonstrated. Well, I would say that there's no need to be nervous about ultrasound. The abdominal ultrasound is painless. You're just putting an ultrasound a camera or probe, as we call it, over the lower abdomen. And other than touching the skin, there's no other abnormal or untoward feeling or sensation. For transvaginal scanning, I would say it's very acceptable, minimal discomfort, and it does not, the ultrasound camera does not get inside the uterus. It stays in the birth canal, and that's one of the advantages of transvaginal scanning, is that the quality of images are far superior to the abdominal approach.